Hello everyone, this is Dr. Dan Bockmann. Good to see you again. I'm a chiropractor here in Austin, Texas, and I have a rehab clinic, a therapy clinic where we fix all kinds of back, neck, spine, knee, hip, shoulder problems. Today in this video, we're going to be answering a viewer question. The question today is back pain hereditary? And the short answer is it can be. And let me explain. So what I mean is, yes, there are some things you can inherit from your parents or your ancestors genetically that make you more likely, more predisposed to having issues that can cause back pain, like ankylosing spondylitis or rheumatoid arthritis. I mean, there are several things. Or even internal issues, you know, if you have Crohn's disease or irritable bowel or ulcerative colitis, some of these things can be passed along as well, which can present as back pain as well, even though they're not back injuries. So again, yes, there is a hereditary component for back pain that can be a contributor or make it more likely for you to have it, but you are in charge of way more of whether or not you have back pain than your genes are. What I mean is the huge majority of low back pain in particular is called mechanical back pain. And all that means is that the reason your back hurts is because things you have done to it or haven't done to it, as opposed to it's in my genes, which is great. So you're in charge, you're in control of how likely your back pain it will be that you have back pain, if that makes sense. Way more in control than your genes are. So yes, you may have some risk factors that make you, 10 or 15% more likely to have back pain, but the 85% you're in charge of. And the big things that, when it comes to back pain in particular, flexibility and strength. Flexibility meaning my back, my hips and thigh muscles are all nice and elastic, and I have full normal range of motion in my hips and thighs, which then takes workload off my low back. And I'll talk about this more in future videos as to why tight hip and thigh muscles are the #1 cause for back pain. But flexibility, hips and thighs, and strength, meaning your core muscles or your core muscle group, which is, depending on who you talk to, it's up to 29 muscles that attach all around your back. Their job is to support and protect you while you go through life and prevent injury. And if any of them are too weak, then that leaves you vulnerable to injury and can make back pain more likely. But by maintaining your flexibility with a good stretching and massage regimen, staying well hydrated so your muscles stay nice and elastic instead of drying up like beef jerky, which is just dehydrated beef muscle, not very stretchy, right? Staying well hydrated, staying flexible, and keeping a regular variety of movement in your life, or adding some in if it's missing. If you have to sit all day, you have to add these things in artificially. You're not out plowing a field or hunting food like our ancestors did. We have to add our exercise in artificially, but it's not difficult, and in most cases it's free. Again, these are things that we'll be talking about in the future as well. In fact, I've developed some online courses that teach you how to identify the weak spots around your back. I have a back pain treatment course, shows you how to find out what's wrong that may be causing your pain, how to fix it, how to prevent it from coming back. So I'll put a link in the description below if you're interested in looking at that. It's all very straightforward and easy. So the huge majority of back pain, the reason you're hurting is not because mom and dad had something or gave me something in my genes. It's because you're not being active enough, not staying flexible enough, or otherwise healthy enough. But that's great news, because those are things you can do something about, and you can make those changes anytime. You can maintain your vehicle that you drive around for the rest of your life in most cases with just a kind of relatively small investment of time and effort. So I hope that has answered the question, is back pain hereditary? If you guys have more questions, please feel free to leave the questions in the comment section below. I'd love to answer those in future videos. And if you want more stuff like this, definitely subscribe over here, ring the bell below. I'm looking forward to seeing you again in the future. Thank you.